Today, we are going to talk about family boundaries. This concept is utilized very much in therapy and especially in family therapy. So we want to make sure that we have clear understanding of it. So let's go over some of the concepts. So essential concept in family systems therapy or theory or therapy is family boundaries. Maybe they're invincible rules, but how families members interact with each other, this plays a big role in how treatment can be applied or how symptoms are manifested or behaviors are manifested. And these boundaries play a crucial role in shaping relationship and ensuring that families operate in a cohesive unit. Now let's look at like different kinds of boundaries. Let's say that we are talking about rigid boundaries, where the families with rigid boundaries are often they exhibit a sense of distance and disconnect between each other. They may be more independent, each member may be more independent, but it comes as an expense of emotional closeness, resulting in minimal support and communication between them. Now, let's talk about clear boundaries. In this one, this is the healthiest type of boundary where roles and expectations are well defined yet flexible. Families with clear boundaries demonstrate balance, connection, and a supportive dynamic fostering individuality and togetherness. Then there is diffuse boundaries in which families with diffuse boundaries, they will overly closed or enmeshed, and this dependency often leads to challenges such as lack of privacy, personal space, making it difficult for individuals to develop a strong sense of self. So in diffuse, there is no strong sense of self. In rigid, you become more independent. So this is like opposite spectrum. So you want to understand that. Now let's talk about family hierarchies. And family hierarchies refer to power structures within the family and authority levels within the family system. Like, let's say that you want to think about functional hierarchy, in which clear parental leadership is established, ensuring stability and healthy boundaries. Children are given age appropriate roles, and family system is guided by mutual respect and order. Now, in dysfunctional hierarchy, there is a lot of parentification also, where child might be forced to take on a parental role. Blurred boundaries and unstable leadership often create stress and imbalance in a family system. So therapies play a critical role in helping families identify and rectify this dysfunctional hierarchy and emphasizing the importance of restoring clarity and responsibility and roles and responsibilities. Okay, let's think about other concept of genograms. This is a powerful tool in family therapy because genograms are visual maps, something like this. This is a genogram, and this will give us an idea of visual mapping of family relationship and patterns across generations. Means like through genograms, therapists can analyze family structure, relationships types, and patterns, and they can see recurring relationship themes, behaviors, and dynamics, and allow therapists to pinpoint intergenerational issues or repetitive cycles. And then intervention can also be looked into. So, for example, like if you look at look at this genogram, you see that there is diabetes here, there is depression, anxiety, how like there is a genetic component playing a role. In the same way, if you look at like a dotted line, it's represent a conflict. And you can use these lines like a close bond and mental health challenge or something. But the genogram gives you an idea about how the dynamic is playing out in the role. These can be used in structural family therapy or strategic family therapy, structural family therapy or strategic family therapy. Genograms are used. This can be an exam question, so look into that. Okay, I hope that this helps. Thank you.